Julia is a 65-year-old female patient who presents with a new diagnosis of COPD. She is experiencing some shortness of breath and chest tightness.
I need help.
Julia, you cold? What's going on? You can't breathe? Let's sit you up, okay? Let's put the nasal cannula on. You're not going to be able to breathe if you don't have it in. Put it on correctly. Good. Take some deep breaths for me, okay? In and out. Breathe in and out. There you go. In and out. Good. How do you feel now? Do you want to sit up even more?
A little better.
Yeah.
I still feel tight though.
Okay. Do you want to sit in tripod position? Does that help you?
Maybe have a try.
Okay. Okay. I'm going to assess you a little bit, okay? Can I put this on? Maybe we'll just get some vitals, okay? How are you feeling? How's your breathing?
A little bit better.
I like that. I'm going to get a blood pressure and a heart rate on you, okay? Just keep inhaling and exhaling. There you go. Okay, we got your blood pressure. It's a little low and your heart rate's a little high. Let me see this. Okay, your O2 is 85. That's definitely lower than we want it, okay? I'm gonna listen to your lung sounds if that's okay, okay?
That's okay.
You can just sit like that. Take a deep breath in and out for me. Okay, I'm listening to the back. Take another deep in and out for me. Okay. All right, Julia, let's get you back into bed, okay? I still want you sitting upright though, and I still want deep in and out breaths, okay?
Okay.
All right, as I listen to your lungs, you're having some very high-pitched wheezing and crackles in your lungs too, okay? So I'm gonna call the provider, your doctor, and I'm gonna tell him about that. I think that we need a different type of oxygen mask because your oxygen is all the way up and you're still struggling to breathe, okay? Do you have any shortness of breath?
Yeah, it's a little tight in my chest.
Yeah, chest tightness.
Yeah.
Okay, I'm going to tell him about that too, okay? And we're going to figure out what medications will work to handle your COPD, okay?
Okay.
All right, do you need anything else right now?
I'm okay.
Okay, I'm going to send someone in to keep a watch on you while I call him, okay?
Okay.
Okay.
Hi Julia, how are you doing?
I'm okay. My chest is really tight.
You're okay? Yeah, your nurse Molly let me know about some shortness of breath you were having. You had an exacerbation. Are you having any difficulty breathing right now?
Yeah, shortness of breath.
Yeah? Okay, she let me know and I put some orders in. I ordered you some albuterol. That's going to be your emergency if you have another exacerbation like earlier. I'm going to get you an ipratropium inhaler. That's going to be your long-term one, so you can take that every 6 hours. And I'm also going to get you some prednisone ordered. That'll be an oral tablet, and you'll take that every day. That'll be for the inflammation in your lungs. It'll help to make your airway more clear to help with your breathing too.
Okay.
Does that sound good?
Yeah, it sounds good.
Perfect.
Okay. Lower respiratory disorders impact the lungs, bronchi, and alveoli. The treatment includes decreasing inflammation and restoring airflow through dilation and treating the cause. The provider gave albuterol as a rescue inhaler, which relieves bronchospasms. However, it causes tachycardia, palpitations, tremors, and chest pain. Ipratropium, cornerstone anticholinergic, bronchodilator in COPD management. It typically causes dryness. Monitoring for dry mouth, dry eyes, or altered vision, urinary retention, and constipation is crucial. Oral prednisone is used in acute COPD exacerbations. Because it is a steroid, it is used to decrease inflammation. There is a risk for many side effects like increase of risk of infection, hyperglycemia, osteoporosis, depression, and water and salt retention. Other drugs that may be used in lower respiratory disorders include beclomethasone, which is an inhaled corticosteroid and more selectively recommended in frequent exacerbations or severe COPD. This med decreases inflammation, preventing the release of prostaglandins and histamine, which cause inflammation. Adverse drug reactions include oral candidiasis, impaired adrenal functioning, osteoporosis, hyperglycemia, and peptic ulcer disease. A spacer as well as rinsing of the mouth are recommended. Use cautiously in patients who already have diabetes and renal dysfunction or take NSAIDs regularly. Montelukast, sorry, I said that wrong, less common in treatment for COPD, but more commonly as an adjunctive therapy for other anti-inflammatory drugs to decrease branch constriction and inflammation. Liver damage is an adverse reaction as well as suicidal thoughts. It is typically given in the evening orally.
All right, Julia, and also I ordered you a simple face mask. That should help keep the oxygen running because you seem to keep losing the nasal cannula.
Okay.
Hey Julia, how you doing?
I'm okay.
This is a simple face mask, okay? We're gonna put it on now.
Okay.
I'm just gonna take off your nasal cannula. And we'll connect this. All right. Do you need anything else?
I'm okay.
Okay. Hey Julia, I just want to reassess how you're doing, okay? I'm just going to check your O2. How you feeling?
I feel better now.
How's the shortness of breath?
It's a little bit better.
Okay, and the chest tightness?
Yeah, it's not as bad.
Okay. All right, looks it's up to 90, so definitely better than it was before, okay? I can take that from you. I'll let the doctor know that those things are definitely working that we got for you, okay?
Okay.
All right, let me know if you need anything, okay?
Okay.